Well, welcome back to the show. He is here, Dr. Stephen Mulholland, cosmetic plastic surgeon at Spa Medica. He is one of probably Canada's most sought after cosmetic plastic surgeons. Welcome back to the show. First of all, it's been a while since I've seen you.
Oh, well, good to see you again. You look ever younger.
Oh, isn't that nice? Thank you. Well, so do you. And actually, we were talking about it. You cut your hair off. Your hair was longer. And it's amazing that you look so different, but you've also lost some weight.
Yeah, I made a commitment to a little more healthy lifestyle, and my wife made me cut off my hair, and yeah, I think it just looks a little fresher. I don't have that 1980s mullet anymore.
No, your hair, you had nice long hair, and a lot of people are rocking that look, and it looked great on you. But when you walked in, I went, oh. It's amazing what a change. So you look great, and I'm glad you're feeling great, and it's good to see you. Last time you were here with David Eddy because I got called off the show that night to do the morning show. So it's great to see you again. I trust you had a good summer, busy summer.
It was very busy. It used to be quite cyclical, cosmetic enhancement procedures. There were some slow times, and now it seems every market segment, every demographic, for example, the summers would be students and teachers and moms whose kids are off overnight camps, and then that keeps it busy. And then the fall is often women whose kids are returning to school, and then the winter is older patients who then go off to Florida. So cosmetic enhancement treatments is not cyclical anymore. It's 365 days a year.
Is it generally, depending obviously on what people want to do, we've got some people on the line, we're going to get to their calls. Is it generally more affordable than people think it is?
Well, it used to be very expensive and exclusive. With the advent of some of our non-surgical treatments, the prices of looking your best and looking natural have definitely come down. I would call it the democratization of cosmetic enhancement. It is now truly within the grasp of everyone who is middle class. So it's not, it is still a bit exclusive in that it's not offered out with food stamps and welfare. But it is a cash payment system and quite affordable. You could look 5 years younger to 7 years younger in your 40s and 50s for an affordable $1,000 to $1,500 a year. Now, when you add up how much most women spend on hair care, nail care, and skin care, $1,500 to look 5 years younger is a pretty good bang for your buck.
Actually, absolutely it is. That's a lot cheaper than I thought you would have said. 416-872-1010. Text us at 71010. Dr. Stephen Mulholland is here. You deal with everything. So you do the surgery, you do the fillers, the Botox, the non-invasive. Like if people have questions about any kind of procedure, you do it all.
Everything. Spa Medica is really full service. We have a very big and busy medical spa that's non-invasive. And then, of course, the plastic surgery center. I'm
going to ask you about it in a couple minutes, but I want to test you. Do you know what the Barbie surgery is?
Yes, and so there is this emerging trend to surgically alter one's features to a barbification, a metallification of the female form. It is, and I would have to say that Canadians in particular are quite conservative and reasonable in their aesthetic goals. We don't have a lot of the Jocelyn Wildensteins who come in and want to look like a lion.
I know what you're talking about. That's a wild story, yeah.
And so just because we could put, let's say, a penis in the middle of your forehead and it's technically possible, doesn't mean we're going to do it.
Okay.
You don't want to be dicking around.
Gotcha. And you're right. I think we are more conservative because you hear about everybody in LA has work done and, all this kind of stuff. But here, I think people just want to look a little bit better and feel a little bit better.
Well, I've been practicing in Yorkville for 25 years. And if you walk around Yorkville, there's definitely a lot of women that have had procedures done, but very unusual to see something ridiculously outlandish and completely caricaturish. And so I think the physicians and patients in Canada, Toronto in particular, are just very conservative and want to look good but natural, or done but undone. So it's the undone done look, which is looking actually too better than you should for your age, but not outrageous.
416-872-1010. Text us at 71010. Dr. Stephen Mulholland is here, and we'll start with Judith. Hi, Judith.
Hi, Barb. Love your show.
Thank you.
I just think, yes, I just had a question, Dr. Mulholland. I've always had an issue with my very short neck all my life. My mother is like, raise your chin, pose with your head up. My neck is very short. I've always been made fun of as a little girl. I've heard that some people got bone removed from their lower shoulder area to make their neck look longer. I've heard some Asian neck binding to stretch the neck. Is there anything I can do to make my neck look artificially longer? Do I have to be evasive procedures or non-evasive?
How old are you, Judith?
I'll just say my 60s.
Okay. And do you have a good neck angle? Do you have a bit of a double chin?
Well, I don't have a neck anymore, I'd say, because of my double chin.
Okay. So in general, if women or patients are shorter and you have a bit of an obtuse neck or a double chin, the simplest way to create the illusion of more neck length is create a good angle of your neck. And so we have some non-surgical treatments like the Cool Sculpt Mini, the Sculpture, an injectable product called Belkyra, where we can, and just submental or chin liposuction, where we can create in about an hour, a better neck angle, and that will give the illusion of your neck being longer. And so, yes, you can do some really radical surgery.
My neck is very thick. It's like a stump. So how would it make it look slender?
Well, what happens is generally your chin goes obliquely down to your neck and there's no angle.
You mean like from your, from
Yes.
here? So you have if you take away this skin underneath?
Yeah, if you take the waddle away,
yes,
then you actually create an angle from your chin back towards your neck, then your neck goes straight down.
Is it kind of like a facelift for your neck?
It's kind of like a contouring for your neck. And what you'll find, Judith, is if you take your finger and you grab your under chin, you pull it back and it gives the illusion of a little more length. That's all you need to do. And those are very simple procedures and quite affordable.
Yes, if only we could all look like Barb.
Right. Oh, Judith, that's funny. You made my day. Yeah, you know what? Isn't it true? Because we're going to break and we've got lots of people waiting to talk to you. We can all find something we want to change.
You know, you have to be a bit careful because you can be, if you're a bit obsessive or prone to being self-critical, you can really get in a cycle that's unhealthy where you don't see what's really good about you and all you see is what's not great about you. And it's never, ever a solution for mental illness or depression or self-esteem. It's about usually cosmetic enhancement and plastic surgery for people who feel pretty good about themselves. They like themselves. They just want to feel a little better. They look good, want to look a little gooder.
416-872-1010. Dr. Stephen Mulholland is here, cosmetic plastic surgeon. Welcome back to the show. We are so pleased to have Dr. Stephen Mulholland back here, cosmetic plastic surgeon at Spa Medica. And he is answering all of your questions about maybe procedures you're thinking of having done, little problem spots on your body, and you don't know what you can do about it. Not that people ever have to do anything about it. And I think we stress that a lot. Sometimes I really envy the people who are just so comfortable in their own skin. I think they're the best off out of everybody.
Yeah, I think we do live in a vanity culture. Some people amazingly seem to rise above that, and ideally we should be judged for our kindness, our personality, our brain, our wit. But thank God we're not, or I'd be unemployed. But sometimes we do focus too much on the exterior surface, on the cover of the book, not the content. And it really is unnecessary, but feeling good sometimes is integrated with looking good. And we've been cultured like that. And so as long as you don't go to extreme, it's reasonable, and your risks are modest, and your recovery is acceptable, and you don't get caught up in the endless pursuit of beauty and youth, and you just kind of embellish the little things that bug you, I think it can be healthy, and it's certainly not for everybody.
416-872-1010. Rob is on the line. Hi, Rob. Go ahead with Dr. Mulholland.
Hey, how you doing, guys?
Good, thank you.
Enjoy your show, Barb.
Oh, thanks.
I've kind of got an unusual one here. I only smile with one side of my face, with my right side. Even though I can do it, if I look at myself in the mirror, I can smile with both sides. Everything functions, but I only smile with the right side, and I only usually talk out of the right side of my face. When I was a little kid, about 4 years of age, I got hit in the left side with a baseball bat. I don't know if that had anything to do with it. So what it's done is it's pulled my nose to the right where it looks like I have a deviated septum, even though I don't. So I don't breathe very well out of my left nostril anymore because it's kind of collapsed. Now, So I just want to know, have you ever heard of anything like that, or is there anything that could be done to get those muscles to respond to my brain, or get my brain to tell my left side of my face to smile at the same time as my right side?
Well, it's interesting, Rob. First of all, if you were a politician, you might be speaking out of one side of your mouth.
Yeah, John Chrétien.
Right.
Yeah.
It's quite common, for example, for patients to have a Bell's palsy when they're young, which is an infection of the inner ear canal, and it squishes the facial nerve, and the facial nerve suffers a weakness, and you can't move one side of your face. And some people have a prolonged, lifelong weakness on that side. When they fully animate, like you do when you're in the mirror, you can actually contract it. But when you do passive, normal conversational activities, the weakened side of your facial nerve never responds as well. So yes, the lid might not close as well, the brow may be a little lower, the corner of the mouth dips down, and you do have a sort of a one-sided, sneery kind of smile.
Exactly. So I have a lot more lines on my right side of my face.
So I think that a baseball bat injury as a child probably resulted in that non-displaced skull, base of skull fracture, and injured your facial nerve to the extent that it still works, but it has to be optimally contracted, like pretend you're contorting to actually work. In normal activity, it's weaker. Therefore, you look less lined, smoother, a little bit droopy, and less animated on the weaker side.
Exactly.
Is there anything? I wanted to ask about his nose. Did the nose sort of looking like a deviated septum? Could that be because he's been smiling on one side for so long, or would that be a result of whatever happened?
Well, there's certain muscles that have funny names that position the tip of your nose, and if one's a little weaker, your nose will deviate. And so I think you just have a latent and lifelong facial nerve weakness. There's not much you can do about it, other than if you get really, really droopy on that side, there are some little nips and tucks where you can kind of balance the passive contour. But you'll always be a sort of one-sided animator. It makes you sort of unique and a little bit different, but in probably a good way. But as you get a little older, you might find the saggy flesh on that side, or the slight asymmetry from the other side. A little tweak now and then may make you passively more symmetrical.
Okay, well, thanks. I don't know if that helped me or not, but...
Well, just celebrate being a little bit different. And unfortunately, the nerve's not repairable because the damage happens centrally inside the skull base. So there's really no cure for it.
But I think what he's saying, though, too, with you said, you have more wrinkles on one side, like little things could be done to balance the look out a little bit.
And that's true. A little Botox on the more animated side, some soft tissue fillers. But most guys do not go in for this sort of repetitive treatment. They want a definitive treatment. And this repeated Botox and filler usually doesn't interest them. And it probably hasn't gotten too much in the way of your life or success. It's just you're kind of an interesting anomaly.
I just sort of off my topic, but I think that in this world, though, I think the more attractive people, they get treated better than the unattractive.
Well, you know what?
So that's an interesting point.
It is unfortunate but true. Study after study has shown if you had two women going for a job of equal IQ, equal training, same degree, one is classically pretty, maybe has nice skin, or the other one is not as pretty or doesn't have as nice skin or not classically attractive, consistently the prettier and the classically more attractive candidate gets the job, gets the promotion, and gets the money. And that's just not right. But it's how visually, aesthetically biased we are in our culture.
It's just like taller people become the supervisors. Why is that?
Yeah, well, they get to...
I mean, I was hearing somebody talk about this today. It was a thing about if you want to have a successful marriage, marry a shorter guy.
Well, I tell my wife that because I'm not that tall, but I tell her that I'm 9'6" standing on my wallet, and that worked for me.
Exactly. And that's what they were saying. They said shorter guys have to overcome or have something to prove, and they end up being more successful, and you'll have a better relationship. You know what? People are people, and there's someone for everyone, and there's somebody who loves every look out there and every height out there and every weight.
No, absolutely. I almost got the role on Game of Thrones with Peter Dinklage, but...
No. I thought you were going to say Jon Snow. With your other hair, you could have done it.
Yes.
416-872-1010. Pat has a question for Dr. Mulholland. Hi, Pat.
Hi. I've lost about 20 pounds, and now I have all this sagging stomach. I'm just wondering what's involved in a tummy tuck and recovery, and how you determine whether liposuction or tummy tuck?
Well, Pat, first, congratulations on losing the weight. That's always a difficult thing. And if you can keep it off and be consistent, then you can attack the extra flabby flesh of the tummy in a couple of ways. If you have a little bit of fat left and there's a roll and the skin's not too loose, modern day liposuction gets good contraction, and that's the simplest procedure. If you have a little bit of loose skin that exceeds that and you've got good core muscle strength, then a mini tummy tuck using a skin-only removal can be done at a local anesthesia and combined with lipo, and that's a relatively simple procedure. Formal tummy tucks involve tightening the muscle, making a new belly button, removing the skin, and that's usually a 3-week recovery, and that kind of gives tummy tucks a bad name. But there's many, many different types of minis where you just remove a little bit of skin at the bottom, especially if you've had a C-section or a previous abdominal surgery. That can be done in an hour and a half under local anesthesia with a week off. So you probably have a few options out there, Pat. If you've gone to the gym, you've done what you can do, you've lost the weight, and it's really loose skin, we do have some options that don't involve a full tummy tuck.
Okay, thank you very much.
All right, Pat. Does it depend on how much or how little weight loss has happened?
Yeah, so if you have extreme weight loss, let's say more than 100 pounds, and you've done something like a gastric or stomach maneuver, like a lap band or intragastric ballooning, or some of the techniques we use to force weight loss, medical weight loss for health reasons, and you've lost 100 pounds, the skin is so loose and so floppy, you have to do surgery. If you've lost 10 pounds, 15 pounds, and there's a little bit of laxity, some of our tightening technologies do very, very well without a scalpel. So don't think you necessarily need to cut things away if you've got modest laxity. We've got good tightening techniques without cutting sometimes.
I saw a show last night. I don't know if you've ever seen it, My 600-Pound Life. And this young woman actually lost 500 pounds. She was a young woman, and the thing was, though, all of the extra skin was, she was just in this depression. She would wear long sleeves and long pants. So slowly over time, she was able to get it all cut away. But that's quite a big deal, taking all of that skin away after.
It is. You lose a lot of weight, and then you have the stigma of the loose skin, which itself can be a bit depressing as a reminder and the stigmatization of your previous weight. And so serial sequential skin removal or total body lifting is not uncommon for massive, massive weight loss. So you start with the arms, then the breast, then the tummy, then the thighs, then the back, and the knees, and the neck. And basically you removed yards of skin that used to house the 600 pounds. And it can be really, really transforming and life-affirming, but it is expensive. It's not for the faint of heart. And if you can all avoid putting on the weight in the first place, that's the easiest way to minimize the risk of ever being in that situation.
416-872-1010. Dr. Stephen Mulholland is here. You good to stick around
I am
for a little bit longer?
Okay.
Awesome. We are going to be continuing with your calls. He is Canada's top cosmetic plastic surgeon. So questions about anything you or someone you know has considered having done, maybe you had something done, weren't happy with the results, give us a call. You're listening to The Night Side on In-Depth Radio, News Talk 1010. Welcome back to the show. Dr. Stephen Mulholland is here, cosmetic plastic surgeon at Spa Medica. We are taking your calls on any questions you might have around cosmetic surgery procedures you've thought about having. Maybe you want some pricing, want to know about downtime. Have you thought about a lot of people doing the what do they call it? The vacation?
Yeah, it's cosmetic surgery tourism.
Yes.
And it's also seasonal. So now I'm getting way more patients to come in and they gift a plastic surgery or non-invasive plastic surgery gift to a loved one. And so a stocking stuffer of wrinkle-free for 6 months.
Wow, that's a great idea. All right, Carol has been hanging on for a long time. Hi, Carol. Welcome to the show.
Hi, how are you?
Good, thank you. Go ahead with Dr. Mulholland.
Hi. So my question is this. I have a daughter that's 19. She's over 6 foot tall, but she has extremely large breasts. She can't get fitted properly anywhere. She's in competitive soccer, and now she's finding that it's causing her a lot of discomfort. She's in pain. She can't wear clothes like the other girls do, and it had actually got her to a point of depression. At college, some of the kids can be really cruel, and financially, I'm not sure what's involved, and I don't really know where to go to help her. So it's such a relief to have you on the show.
Well, thanks, Carol. That's a great question, and it can be very, very debilitating. And so, macromastia, it's called, or enlarged breasts that cause pain, discomfort, shoulder, neck pain. The bra digs in; it can cause inflammation under the breast skin. If you see a plastic surgeon, can be submitted to the Ministry of Health and is almost always covered by the Ontario Health Insurance Plan when it's associated with the symptoms your daughter has. So, so the costs would be covered. You have to then be familiar with the scars, and they can sometimes be initially and early on quite unsightly, but there are many, many treatments for scars where the redness and the discoloration can vanish. But it can be quite transformative. You can get a much more proportionate breast, shoulder, waist hip ratio. She'll be much more athletic. The pain will disappear. So for the right patient, it's really an amazing procedure.
Well, in the family, it sort of runs in the family. So there's her cousin had to do the same type of surgery to reduce her breast. She actually did it twice. And so now my daughter, like initially, right, when she was younger, she's like, oh, yes, look at me. But now in the last year or so, it's becoming unbearable for her. And when she's playing soccer, she has to do anything she can to be able to run. And she scores goals, but by the end of the game, she's actually can be in tears.
Well, I would get your family physician to refer her to a plastic surgeon in your town or city, and and he would submit to the OHIP insurance plan, and there'd be a bit of a queue, but she would get the procedure, and I'm almost certain she'd never look back. Yeah.
Carol, thanks a lot for the call. And that's what I was going to ask. So if people are in that position where it's a medical or a health issue, go to the family doctor first.
Yeah, the family doctors are the gatekeepers for referral, and they'll have relationships with local plastic surgeons.
I have known a couple of women who have had that procedure done, and not only have they not looked back, they have never been happier. I think it's something that women who need that procedure live with for a long, long time before finally making the decision.
Yeah, we live in a culture where so much is written and talked about breast augmentation, making breasts bigger. But one of the most common procedures is making breasts smaller for patients and who have disproportionately large breasts that causes symptoms that are really quite uncomfortable, pain or inflammation, and it really changes their lives.
So a couple of stories I wanted to ask you about. One is, and I feel like we talk about this every time that you're in, but the story just keeps coming up. More and more patients under 30 are getting prejuvenation or preventative Botox. I don't even know if I can ask you this, but we're not talking about any specifics. Have you noticed an increase in younger patients just in what you do?
There is absolutely no question. It's this millennial phenomenon that the average age of patients first engaging in something like Botox in my practice has gone down 10 years in 10 years.
Wow.
So the average patient used to be 40. Now the average patient's 29 or 30. Now I have 6 kids. 4 of them are millennials in their 20s. And they're a very odd generation. I've got to say, I don't know how we created these kids, but they live in a culture of handheld validation. All I can say is they are judged. They interact by visual imagery, a 5-second Snapchat, a selfie. And it's gotten to the point where selfie enhancements and little filters and creating a better image than you are has become paramount, almost weirdly so. So I think that millennials are obsessed with imagery and with online imagery, and the immediate social impact of your profile or your 3/4 shot has changed the incidence of rhinoplasty. It's changed when they do Botox and soft tissue fillers, how they create lip shapes. It's really quite bizarre. And back in our day, we wrote a letter, so
I know nobody had to see us.
I know you could correspond with someone without even worried about how you look. And the other thing that's very, very competitive for jobs now for young people. And they're very practical, and there's no qualms about vanity. They'll do what they need to do to get a job, and looking your best usually means you're more employable, unfortunately.
Someone texted in and said, in spite of exercise and good diet, years of neglect have given me chest flab and borderline man boobs. Is there a solution for this?
Yeah, so male gynecomastia or the 50-year-old male boobie is quite, quite unattractive when you want to wear a tight shirt or go to the beach and self-conscious. It feminizes your figure. And so we have some really great technology, this particular procedure called the Body Tight or Smart Lipo or devices where we can melt the fat and tighten the skin without big scars. And so it used to be you had to have a breast reduction scar as a man. Well, we can go topless at beaches. That's the usual point. And then you'd have this debilitating scar. And so the ability to do scarless breast reduction on men with that little bit of feminization that can happen in the 50s is really changed a lot of guys' lives. So look for practices that offer procedures like that, scarless chest reduction, and it really can be transformative.
Are there men who have that kind of those kinds of features but do not qualify?
If you are glandular, meaning it's firm and breast tissue and not fat, you can still melt the glandular tissue, but you may have medical contraindications. And this goes for any listener. You may want cosmetic surgery, but if you're medically unwell, you have a heart condition, you've had a stroke, or you have uncontrolled diabetes, you're just not medically well. Cosmetic surgery is just not for you. And so if you're medically well and you have glandular tissue and you don't have a pacemaker, and you're a good candidate for that.
Dr. Stephen Mulholland, always great to have you here. Thank you so much for this.
Always.
And, I know you'll have a busy Christmas season because apparently people need to be ready for their selfies.
Yes, and they need to look good under the mistletoe. Absolutely.
Yes. All right, we'll see you soon. Thank you so much.
Thanks again, Barb.
Dr. Stephen Mulholland, cosmetic plastic surgeon at Spa Medica.